Welcome to the first Fast Info Friday on the Fearless Mothering podcast, where we try and tackle big, bite-sized pieces of pregnancy information to help you feel encouraged, enthusiastic, and fearless. You're listening to the Fearless Mothering podcast. I'm your host, Alex Schoenberger, and this is the show for moms who are looking to enter motherhood encouraged, enthusiastic, and most importantly, fearless. We are going to try and quiet the noise, bust the fear, and help you feel deeply confident in your body, your birth, and your motherhood journey. Today we are talking about something I see all of the time: pregnancy myths. You know, those things that people say that sound true because they've been repeated forever, but actually cause so much unnecessary fear and self-doubt. So we're going to unpack where these fears come from, what's actually true, and how you can reframe them so you feel empowered, not anxious, as you move through your pregnancy. So grab your cup of tea, take a deep breath, and let's bust into these myths together. So first off, before we dive into the myths, I want to start by why they exist in the first place. Pregnancy has been around forever and has always been surrounded by mystery, especially for first-time moms. Generations of women passing down stories, advice, cautionary tales. Many of those stories were rooted in love, but also in fear and trauma. Fear of something going wrong, fear of not being enough, fear of being judged. And because birth has taken out of our homes and put into hospitals, that wisdom got replaced with rules and warnings. So somewhere along the lines, women stopped trusting their bodies and started trusting systems instead. So when someone says you shouldn't do X while pregnant, it's usually coming from a place of wanting to protect, but it's not always true or evidence-based. And that's what we're reclaiming today: truth over fear. So let's get into these myths. The very first one: you can't trust your body. Pregnancy is dangerous. This is a big one, and honestly the most damaging. You've probably heard things like you never know what can happen, or your body might not know what to do. But here's the truth: your body was designed to do this. Yes, complications can happen, and medical support is a beautiful, life-saving resource when needed, but that doesn't necessarily mean that birth is inherently dangerous. In fact, for most healthy women, pregnancy and birth are normal physiological processes. Your hormones, muscles, and even your emotional shifts are all perfectly orchestrated to support this process. So when you hear your body might not be able to, pause and remind yourself, my body knows how to grow life. My job is to support it, not fear it. It's not about ignoring risk. It's about trusting your body's wisdom while staying informed and supported. I think especially for families who have struggled with getting pregnant, this is one where you really have to turn inward and do that work and try to tune out all of this, people who are saying this out of what they think is love and protection. Because especially if you are wanting a low intervention birth and you've had infertility or pregnancy after loss, there's so much work that you already have to do. So my body knows how to grow life. My job is to support it, not fear it. Let's get into myth number 2. You have to give birth a certain way. This myth is everywhere. You should get the epidural. You shouldn't get the epidural. You need a hospital birth. You need a home birth. The truth: there is no right way to give birth. Fear shows up when we're told our choices are limited. Empowerment begins when we realize we have choices. In my doula practice, I often say, if you don't know what options you don't have options. So every woman's definition of safe and supported looks different. So for some, that's home birth surrounded by candles and twinkly lights, midwives, and a doula. For others, it's an epidural in a hospital with their favorite playlist on. Fearless birthing isn't about how you birth, but about how you feel in your birth. So you deserve to understand your options and choose what aligns with your body, your baby, your beliefs, and of course, your risks. The next myth is you should avoid exercise or movement. Okay, how many times have you heard, don't lift that, or be careful, you're pregnant, sit down? While rest is obviously important, I think we all know that when we're so tired, movement is essential during pregnancy. So, unless your provider has given you medical reason not to, moving your body, so walking, stretching, strength training, prenatal yoga, and so on, helps circulation, reduces swelling, improves mood, and even prepares your body for birth. So pregnancy isn't a condition to protect from, it's a process to participate in. So the goal, of course, isn't to push your limits, it's to stay connected. So movement reminds your brain and your body that you're strong, capable, adaptable, just like you'll need to be in labor. So one thing I do want to say on this before I move on to the fourth myth is that obviously I'm not a medical provider. You need to be talking to your primary care provider before making any decisions, but I highly recommend working with some sort of physio, especially a pelvic physiotherapist. If you're in the Edmonton or Spruce Grove area, which is where I'm located, I'm going to tag an amazing pelvic physio in the show notes. All right, let's get on to myth number 4. You're eating for two. This is classic, usually followed by someone handing you a second piece of cake. While your calorie needs do increase, the goal isn't to double what you eat, it's to nourish deeply. I was just at a Doula Association of Edmonton meeting where we got to meet with some Chinese medicine specialists and acupuncturists, and they were mentioning that it's about 500 extra calories, give or take, for a pregnancy. So your baby doesn't need extra junk though. They need extra nutrients. So we need to focus on balanced meals. So thinking like protein, healthy fats, iron-rich foods, fruits and vegetables. So instead of thinking like eating for two, I want you to think nourishing for two. You're building an entire human being, right? So because your baby needs most, what your baby needs most is a mother who's cared for and fed, not pressured or guilted. I had the privilege of doing the pregnancy prep roadmap with the pregnancy prep RD. She's incredible. She also works in pregnancy and postpartum as well. And I'll make sure to tag her below. If you're trying to navigate this eating for two / nourishing for two, she is definitely amazing. All right, myth number 5, birth is something to fear. This one breaks my heart because it's so common and so untrue. Literally the entire reason why I created Fearless Birthing, which is my doula collective in Alberta. Our culture teaches women that birth is traumatic, chaotic, and out of control. The images we see in media reinforce pain instead of peace. But when we look at birth in environments where women feel safe, supported, and respected, what we see is power. Birth is primal, sacred, and yes, intense, but fear and pain aren't the same thing as those. Fear tells your body to tighten and resist. Trust tells your body to open and release. When you learn how to work with your body through breath, relaxation techniques, and mindset, birth becomes not something to fear, but something to experience. There's one thing I want to talk about before I move on, which is when we are in fear, we can enter what's called the fear, tension, pain cycle. And I talk a lot about this to my clients, and I'm sure I've even talked about it on the podcast before, but it's been a while. So this is the idea that if we are afraid of something, let's say a bear comes running into the room that you're in, we are automatically going to hold tension because we're trying to protect our body from something that we see as a danger to our well-being. And so we are going to tense to protect. However, when we are in a situation like labor and birth, where tension is not something that we want, we can get into the cycle of fear, tension, pain, which means we're afraid of our doctor. We're afraid of an episiotomy. We're afraid of tearing. We're afraid of an emergency C-section. And that causes us to tense and hold tension. And that tension actually increases our pain receptors because we are using the wrong muscles to labor and push out our babies. And so that reiterates to us the fear that this is too hard. We're not going to be able to do this, which is going to cause more tension, which is going to cause more pain, which is then going to reiterate that fear belief. And that just continues. So we really want to learn to work with our bodies possibilities rather than fight against them. So let's reframe fear into trust. Here's a way that you can do it, Mom. When you hear you can't, replace it with I can learn. When you hear you shouldn't, replace it with I'll decide what's right for me. When you feel fear, replace it with curiosity. You don't have to blindly follow myths or expectations. You get to write your own motherhood story, one grounded in knowledge, truth, and love. One thing that I really want to mention, and I'm trying to keep this episode less than 15 minutes, is that birth is intense. Birth is probably going to catch you off guard. Do the education. Do the extra work. Learn to relax every single muscle in your body. Become self-aware and curious about your body is feeling and why it is feeling that. So if this episode helped you release even a little bit of fear, would you share it with another mama who needs to hear it? This is how we get our community to grow, one empowered mama at a time. And if you're ready to dive in deeper into preparing for your birth without fear, check out my free birth preferences checklist. It'll help you start mapping out what matters most to you, and you can find it linked in the show notes. So next week, we are exploring understanding the hormonal shifts of pregnancy, one of my favorite topics that'll help you trust your body on a whole new level. Until then, take care of yourself. You're doing beautifully.